Good evening, one and all. Myself, Dr. Roopasree, consultant in obstetrics and gynecology, Hyderabad. Most of the students in their PG life or while studying for NEET PG, final year MBBS, they feel little difficult regarding the fetal circulation topic. Okay, let me make it easy for you all by simple flow chart and also a diagrammatic explanation, which take not more than 5 minutes and all. Okay. Mm, okay. Now first. Okay. For fetal circulation, there must be umbilical arteries, okay, which are two in number, and umbilical vein, which is one. You all know that only one umbilical vein is present, okay. Out of two, one disappears and one is left, okay. See, this umbilical arteries carry the oxygenated blood from the fetus to the placenta, okay. And umbilical vein carry oxygenated blood from the placenta to the fetus. Okay. In this slide, there are some of the multiple choice questions like how many umbilical arteries are present? 2. How many umbilical veins are present? 1. Okay. And which carries the oxygenated blood and which carries the deoxygenated blood? Okay. This is the second. And from where to where? From placenta to fetus or from fetus to placenta. Okay. Now for fetal circulation, the basic requirement you should know is umbilical arteries and umbilical vein. Okay. Next, what happens is the oxygenated blood in the umbilical vein enters from the placenta to the fetus at the umbilicus part. Okay. Now it should pass from the placenta to the fetus. Where it enters? It enters at the umbilicus. Okay. From umbilicus, the umbilical vein passes from the undersurface of liver at the falciparum ligament. Okay. From there, the oxygenated blood of umbilical vein mix with the oxygenated blood of portal vein. Okay. This whole blood now enters into ductus venosum. From there, it enters into the inferior vena cava. From there to right atrium. Okay. The flow chart, you can remember it very easily. Okay. Two methods. One is flow chart method and other is a diagrammatic explanation. So now from the entry, from the umbilicus point to the heart, how it enters? First, umbilical vein passes under surface of the diaphragm at the falciparum ligament. There it mixes with the deoxygenated blood of the portal vein. Now the mixed blood, okay, this oxygenated deoxygenated blood enters into the ductus venosum. From there to the inferior vena cava. From there to the right atrium of the heart. Okay. This all point is of one stretch till the heart. Now, from the heart, what happens is the next slide. Okay. Now, from the right atrium, almost 75% of blood enters into left atrium through foramen oval. I think you all know this from your childhood. From third class, fourth class, you'll be studying. Okay, connection between the right atrium and the left atrium is foramen oval. From the right atrium through the mitral valve, the blood enters to left atrium. Okay, sorry. From left atrium, it enters to left ventricle. Through the mitral valve, it enters the left ventricle. From there, blood passes through ascending aorta. From there to arch of aorta. There it supplies the from arch of aorta it supplies the head, neck, brain and arms. Okay, this is other portion. First, from where to where? From the umbilicus to that of the heart. From the right atrium, heart, it enters to the left atrium. From there, again how it supplies. That is the other part. Okay, second part. Now, from the right atrium, 25% of the blood enters the right ventricle. How? Through tricuspid valve. From the right atrium, it enters into the right ventricle through tricuspid valve. From there, it enters into the pulmonary trunk. But because of high resistance in the pulmonary arteries during fetal life, blood enters to ductus arteriosus. It enters to ductus arteriosus. From there, it enters to descending aorta. From there, it enters to umbilical arteries. From there to placenta, where it is again oxygenated for recirculation. Okay, now you all understood now? From the placenta to the fetus at the umbilical point, 1. From there to the right atrium, second one. From the right atrium, the blood enters into the left atrium, through the mitral valve, left ventricle, ascending aorta, arch of aorta, and it supplies all the head, neck, brain, and arms. This is 75% of the blood is circulating here in the left side. 25% of the blood enters into right ventricle. From there, it should enter into pulmonary trunk. Because of the high resistance of the pulmonary arteries during the fetal life, blood enters to ductus arteriosus, from there to descending aorta, and from there to the umbilicus arteries, and again to the placenta. Okay, the questions they can ask here is, blood from the right ventricle or pulmonary trunk passes through descending aorta. How? Means it enters through ductus arteriosus. Questions can be like this. How much amount of blood passes from where? From right atrium, how much? It's like true statements or false statements they can ask. From right atrium, almost 75% of the blood enters into left atrium. That can be a question. Okay? Like that it can ask. Now we have seen the flowchart pattern. Now let us see the diagrammatic representation. Okay? As I said, see, this is the placenta. Okay? Placenta. I have already said that this is the fetal umbilicus. From the placenta, see, this is the fetal umbilicus. I have already said that the umbilical vein carries the oxygenated blood. Therefore, it enters through the umbilicus. See, umbilical vein entering through the umbilicus. From there, it enters into the undersurface of the liver at the falciparum ligament. Okay. In the liver, it is mixing up with the portal vein. Okay. This is the portal vein. This is the umbilical vein. This is the portal vein. Okay. Both of them are getting mixed here. From there, it is entering through the ductus venosus. Okay. Ductus venosus. From there, it is entering into the inferior vena cava. From there to the right atrium of the heart. Okay. This is the one step from here. Okay. From the right atrium of the heart, see, this is the foramen ovale. It is entering into the left atrium. From left atrium, it is passing to the left ventricle. And then the blood enters into, see, this is the ascending aorta and this is the arch of the aorta. Okay, arch of the aorta. And it is supplying the head, neck, brain, arms. Okay. So it is supplying like this. Okay, the left side is completed. Now the right side, from the right atrium, 25% of the blood enters into the right ventricle. From there, it enters into the pulmonary trunk. Okay, pulmonary trunk. But because of the resistance of the pulmonary trunk, it enters into the ductus arteriosus. Okay, from there it enters into the descending aorta. See, this is the descending aorta. From there, it again enters into the, see, these are the umbilical arteries. It is a deoxygenated blood. See, this umbilical arteries is entering into the placenta for recirculation. Simple. If you remember it in the flowchart manner or in the diagrammatic manner, you can remember more easily and it will be very helpful for answering you in 4 mark questions or viva or multiple choices. Okay? You all understood it now? Okay, this is a simple pattern. You can remember it. And thank you all.